everyone. Welcome to the Green Table Talk, the Our Health Matters Green Table Talk. This is a very special one because we are in collaboration with Black Women's Health Imperative and the Buckhead Cascade City chapter of the Links Incorporated. Today, we are going to be talking about Black women's health and how it shows up in our collegiate and young adult female populations. And we have some very, very special guests to help navigate that conversation. My name is Goody Howard, and I'll be your moderator today. So let's get started with introducing our lovely panel. Okay, so I'm going to let them all introduce themselves, but I'm just going to bring them up so we can all see their beautiful faces. So the first person I want to introduce is LaDeia, and she is the founder of The Positive Experience. Welcome, LaDeia. Thank you so much for joining us.
Happy Tuesday. Happy Tuesday. Do I just start introducing myself? Is that what
Well,
you
no,
want
I
me to
want to
do?
bring everybody up and then we can get
Okay,
the
cool.
introductions going.
Hey,
I just
y'all.
want to get these pretty faces up here for the people, honey. The
Hey,
next person
people.
we have is Dr. Andrea Dunn from the BeeHive, the founder of the BeeHive. Hi, Doc. How you doing? You good to say? Oh, you're muted, but that's fine. That's fine. And then the last and lovely face that I'm going to bring up for y'all is Chanel Jaali of Jaali Co. Hi. Now, the first person I introduced was LaDeia, so I really want you to go ahead and introduce yourself first. And then please, ladies, intro yourselves in order of presentation.
All right. No pressure, huh? No pressure. Good evening for all of us who have joined us to share space this afternoon. I am LaDeia Joyce. I am Memphis born, Atlanta forged, and Brooklyn propelled. I'm currently residing in City Beautiful, which is Orlando, Florida. I am the founder of The Positive Experience, where we believe that being diagnosed with HIV, especially as a Black woman, is not just a moment in your life, it's an experience, and we want to make that a positively lived one. By day, I'm a marketing and promotional strategist. Been doing that for 21 years now. By night, I'm an HIV positive influencer, activist, speaker, life coach. And what else? I'm a proud member of Zeta Phi Beta Sorority Incorporated, just making 22 years a couple of days ago. And I think that's it. That kind of rounds it out, right?
Oh,
So
that was perfect, honey. That was inspiring. I'm gonna get this propelled and all of this. I'm adding that to my thing. Dr. Andrea, can you unmute yourself and introduce us to the people?
Absolutely. Hi. It's a lot going behind LaDeia with that introduction. It was
Right.
great. I am Dr. Andrea Dunn, and I am the founder and CEO of Let's BeeHive. That's an acronym for Let's Be HIV Educated. And so I am so excited to be here today. By trade, I am a board certified pediatric clinical pharmacy specialist, and I am running my nonprofit on the side. And I'm also a member of Alpha Kappa Alpha Sorority Incorporated. So, to all my sorors out there, hello. I have also been doing a lot of HIV advocacy. Wow, for years. I'd probably say since it all began about 2003, my advocacy began, but I would say probably within the last 7 to 8 years, it got heavier. And so we've been around now for about almost 7 years. So super excited to be here today.
Thank you so much for joining us. All right, Chanel.
Hello, everyone. Can you hear me okay?
Yes.
All right, awesome. My name is Chanel Jaali Marshall, and I am a sexologist. I focus on Black sexuality specifically. I also do HIV education and testing coordination and testing at a health system in the DMV area. And I guess the last thing I am is a PhD student. So if you see me looking a little tired, it's because a sister been trying, okay? But yes, I'm getting my PhD in human sexuality.
Yes. Okay. Now, you know what I didn't do, though? I didn't introduce myself. I'm so excited to have these ladies. I just wanted to dive right in, so I didn't even introduce me. So I'm going to introduce myself real quick, and then we are going to get into this green table talk. I'm so excited to have you guys here. For those that don't know, my name is Goody Howard. I am a sexologist, educator, and consultant. I've been doing all pleasure inclusive education for a little over 17 years, full time for 6. And I also am a PhD candidate, so I feel you, Chanel. I don't know something about us sexologists. We just feel the need to go and get these PhDs. Mine is in health education and promotion. So yes, we are all of the degrees and the amazingness and the Black girl magic that is happening here today. I'm just excited about it. So we're gonna get started, y'all, because as women in this field, I would love for us to come together and just have this conversation about young Black adult women that are being impacted by HIV, right? So, but the first thing I want to ask y'all is like, as public health professionals, right, what kind of relationship dynamics, right, relationship challenges, issues, or dynamics do you see in the populations that you serve, specifically around college age women? Anybody can answer that. That's for all of you. So
I can go ahead and start. So I test people, and I also do like guest lecturing, and I'm in the universities and things like that. So they keep me young, and I'm always learning new terminology that I'm like, what now? But anyway, what I will say as far as relationship dynamics, I see a lot of uncertainty, and uncertainty about what a relationship is supposed to look like, as well as uncertainty of the self. And, I think that particular age range, I remember when I was that age range, it's a lot of learning. It's like a really steep learning curve, right? And so I think it's just about navigating all the aspects of life. You are, kind of a beginning adult. And so you're trying to figure out a lot of things while trying to, quote unquote, leave childhood behind. So a lot of times that's what I'm seeing is just literally them trying to figure things out.
Yeah, it's that big bridge between like the high school and now,
right,
or just after high school. It's that uncertainty, that kind of figuring out where you fit into adulthood kind of thing,
exactly.
Right? LaDeia and Dr. Andrea, do you have anything to contribute to that?
I would say, because I'm more like the HIV positive influencer, the sorority girl, the auntie that bops around. I don't have, my background's in marketing, so when I come into the room, we have real talk, real conversation. Auntie here, let's talk. So when I go back and I talk to the young ladies, I'm astonished about how much they don't know when it comes to HIV and AIDS and STIs and STDs. So it's like, after we get through, the banter, it's like, no, let's lean in. Let's have these real conversations, because a lot of them, I've had people who don't realize how STIs and STDs are transmitted. They don't understand what getting a full panel is. They sexually active, but have never had a full panel to be run to include HIV and herpes. They don't know how to exercise their efficacy or their advocacy when they walk into a doctor's office to ask. Many of them don't know how to negotiate condom usage, right?
Yeah.
So you're talking about highly active bodies, this in between stage from teenager to adult, and y'all doing very adult things, but somewhere along the continuum, for lack of better words, they have not been empowered or instilled the language, the knowledge, the know-how to navigate this new sexual space. And a lot of times it's astounding, but I live in the South, originally from Tennessee. Tennessee is a abstinent only state. So a lot of it, there has been a disconnect between the years I've graduated from high school and looking back and realizing y'all really ain't getting no type of sexual education. For us, it was real graphic. It was real in your face. It was like pictures and everything else. But if nothing else, we knew the names, we knew the side effects, what it can affect. Now, we may not have paid full attention, but we did get immersion into what STIs and STDs look like, sound like, could possibly lead you with. But the disconnect. So that's what I'm finding. And it's just, again, especially for women of color and Black women, the access to prevention, education, awareness is even lower. Yeah. So it's just, that's what I'm finding. It's a nuanced area that's necessary. So I'm thankful for stuff like this and places and spaces like this, because it's needed and necessary.
Yeah, yeah. I think too, when we're trying to again bridge that gap from adulthood or from high school to being an adult, right? Suddenly, these young women are expected to move through the world, make their own doctor's appointments, talk to the doctors for themselves, advocate for themselves, and they've never had to do that. And so then, what do I ask? How do I ask? What is some of the things I want to ask you, LaDeia, about the testing? You talked about the full panel, right? When we're talking about young Black women, what is something that they need to know, like a quick takeaway that they need to know about getting tested?
Exercise your advocacy, especially if you're in the South, because even providers will give you pushback. Like, why do you need this? It doesn't matter why I need it. I asked for it. Oh, I'm sorry. I asked for it. Do it.
Mm-hmm.
So real quick, it needs to be a full panel, and they need to test at least 3 orifices of your body. Or like 3.
Yes.
It
Yes.
needs to be a mouth swab, blood drawn, urine. I need 3 of them. That means 3 orifices and some type of swab. And so vaginal swab, mouth swab, I need some body fluids included, because for so long, a lot of times you may be thinking you're getting full panels, but if it ain't 3 swabs or 3 type of samples, you're not getting a full panel, sweetie. So that's a real quick takeaway when you walk in that room and they say, oh, we did test. No, you didn't. You didn't draw blood. You didn't ask for urine. You did not swab a thing.
Yeah.
Run that back, Turbo.
Yeah, yeah. And I think, and that's great, because when we think about that, people don't understand that your throat and your mouth have a different area. So if you get a genital swab, you can still have an STI living in your mouth and throat that did not get picked up. Your blood is going to come back one way, your genital swab is going to come back one way, but that oral swab can change your whole life. You know what I'm saying?
Yeah, another swab I think that's really important to include as well is our anal or orifice,
Very good.
because
Yeah.
there is a huge fad, and it's been going on for a long time, but where women are starting to transition into engaging in more anal sex, and it's not just something that is composed of people who are experiencing it that are of the gay population, that heterosexual women do engage in anal sex as well. And so that's one area that's often kind of missed or forgotten about when you're trying to get those swabs and getting that full panel done, because you can get sexually transmitted infections in that area just as well, and that can increase your risk. Honestly, that's the highest risk of contracting HIV is through the anal route. And so I think a lot of times females may have a myth of thinking like maybe it's not going to happen to them because they don't consider themselves to be, gay or homosexual. So another thing that I wanted to kind of piggyback based on that last question you had asked too, we have to think about what our youth, from when they're transitioning from high school to college, and the access to social media, they already have, access to anything they want to Google. And then you have to think about how hypersexualized everything is, and how I think there's so much emphasis on body image and being able to lure men and get men in through sex and things of that nature, that there's that lack of knowledge of not thinking about all the other consequences that come along with sex. So it's a lot, but getting those full panels, you definitely have to ask specifically, because they will not test you. And if they do test you, typically, for example, in emergency departments, they may only test you for chlamydia and gonorrhea, which are the 2 most common sexually transmitted infections. And a lot of people are under the false impression that they've been tested for all STIs, and you have not. So that's really, really, really important for people to understand. And you may have to ask a few times, and even a lot of healthcare providers may try to talk you out of getting some of these other tests that you need. But you have to really, as LaDeia mentioned, continue to advocate for yourself and continue to ask for these things. And they should be giving you these tests if you have to continually ask for them. But it is a challenge, especially for Black women.
Exactly. And okay. Another thing I wanted to talk about, we just mentioned anal sex or analingus, etc. If you're not swabbing your mouth and you have an STI in your mouth, and then you perform analingus on someone else, which is mouth to anus contact, then you can acquire or transmit the STI in that way. But also, because everyone has a butthole, there's no, like, you know what I'm saying? It's you need to be tested in that, and paying attention. But also, I read a study maybe 2 or 3 months ago that women that are higher educated, collegiate and up, tend to explore anal sex more because of their higher earning potential. And so they have it's something about the connection to intellect and earning potential that frees them up for more sexual adventure. We're specifically talking about HBCU and collegiate Black women. So listen, that's us, that's y'all. We're all, you see all these doctorates and MBAs and things popping. It's us, it's y'all. So please advocate for yourself. Ask specifically for an HIV test. And if they won't give it to you, make sure they write it in the notes. Demand that they write it in the notes, right? Another thing I just want to ask all of you, when we're thinking about safer dating and the hookup culture, right? College is the time, honey, with your parents, especially if you're on campus. You are not your mama's house anymore. You can come and go as you please. Class is optional sometimes. What does that look like with the hookup culture shortening the span of time between when people meet and when they first engage in sexual activity? How do you feel like that impacts Black women in collegiate spaces or young adult women? And what can they do to maybe protect themselves a little differently? And that's for all of you. Yeah.
Okay, so I was gonna say something earlier. So are we being real, raw, and transparent? Because to answer the other question, I'll be like, wherever you receive sex is where they need to swab. But I didn't know how real we could be in this conversation with what
That's
we're
it
doing.
right there.
Okay, cool. All right, all right. So because I like to remove morality from sex, because misogyny, patriarchal, all that kind of stuff already oppresses Black women when it comes to our expression, when it comes to sex. So I'm not the one to be here to be the moral police about how you hook up, when you hook up, and who you hook up with. Since I just want you to have not safe sex, I want you to have healthy sex practices. First and foremost, are you exercising consent? Is this something that you want to do? Is this for your pleasure? If it is, okay, boom, let's proceed. Do you have the necessary tools in your toolkit to ensure that this is going to be a continued healthy sexual experience? Meaning, do you have your dental dams? Do you have your internal or either external condoms? Do you know how to put them on properly? At any point that you feel unsafe, you need to advocate for yourself and be like, no, it's time to go. And above all that, make sure that it's something that you want to do. Again, I'm not the morality police. I believe, sex is an expression. We are human. It happens, right? Do it for your leisure. Do it for yourself, but also navigate it in such a way that you are safeguarding yourself and ensuring that each and every experience is pleasurable as well as healthy.
I appreciate that. Ladies, anybody else want to chime in?
I mean, I don't know what else to say. I mean, Auntie LaDeia has wrapped it on up. I will also say, to LaDeia's point, have those conversations. If you are having, if the time span is shorter, okay, you need to be having some real conversations. It always reminds me of when my mom was like, if you're grown enough to do, you better be grown enough to talk about it. That stuck with me specifically, but it's also something I try to promote. Like, well, let's figure out how to, y'all on the phone, in that phone all the time, even if it's a text conversation about, okay, whatever the topic needs to be. But just really promoting communication, because we're literally so connected, but we still somehow have a disconnect when we're communicating, right? Mm-hmm. So use what you have to your advantage, all of the communication that you have, all the resources that you have.
Yeah. I think we think about, a lot of people think condoms automatically, or they think safer sex practices. I love LaDeia's reframe of healthy, safe practices, because wellness is important. This is Our Health Matters green table talk, right? Our health matters. And so when we talk about, a lot of times when you hear safer, there's a language, there's a weight to the language that we use, even with STIs versus STDs, right? That language, HIV and AIDS, we don't call it AIDS anymore. We call it advanced stage HIV now, right? The language that we use not only impacts the way we navigate around these topics, but it also it helps with the social stigma and helping ease stigma, because when people hear AIDS, people get terrified. But it's not something to be terrified of. It's not a death sentence. It just changes how you live. It just changes. It doesn't end. You know what I'm saying? And I think that people, when we shift the language, like Chanel, how you said, when you're on college campuses, you're hearing new language and things like that. We're on these calls with the CDC, et cetera, and they're saying, oh, it's not AIDS anymore. It's advanced stage HIV now. Okay, that changes how people receive that information. It changes how people move around that information. And I'm curious, just, with a snapshot, Chanel, if you could just give us a snapshot of the HIV epidemic as it pertains to Black women in the United States, especially for this age group that we're talking about now. If you can give me like a snapshot of that, and then like what are some care options for people living with HIV?
Absolutely. I have my notes here. So I'm real particular about stats and whatnot. So you'll have to excuse me getting really nerdy for just like 2 seconds. Give me 2 seconds of nerd and then I'll bring it on back. So when we're talking about what in my clinic is like lifetime risk, right? And so the stats are from around 2017, because as we know, data has to kind of catch up to actual life, right? But when we're talking about Black women specifically, you're looking at about 1 in 48 Black women will be diagnosed with HIV in their lifetime as it stands right now. This is compared to 1 in 222 Latinx women and 1 in 880 white women.
And we're talking about cisgender women, right?
Cisgender women. Yes. Gotcha. Thank you for that correction. Cisgender women. And so that's how we're looking at it nationally. So you can see, if I could show you my little bar graph here, the line is quite different, right? And so this is important in that Black people, generally speaking, are disproportionately affected by HIV in general compared to any other ethnicity. And so it's really important that I say those stats so you realize, like, wait, if you start to calculate in the numbers, like, that's more, it's getting a little closer and closer and closer, right? And so if you look at it nationally, you'll see darker color in the South. I live in the DC area. It's popping over here as well. And, in DC is very interesting because you have people on the Hill and, lawyers and all of these super book educated people. And you see these numbers are quite high in this area. And so if people come see me, if they come get tested and I can give them information, the only way that you know how to care is to first get tested. You have to know your status. And I know that's like an old phrase that we've been saying for many years, right? Like, know your hashtag know your status. But actually, yes, know your status. It's important to get tested. I tell people to get tested as a part of your normal healthcare routine. Like LaDeia said earlier, like Dr. Andrea said earlier, life happens, right? Life be lifing, sex happens, and that's just what it is. But if we consider sexual health as a part of our overall health, then we can wrap all the testing we need along the way. So people who come to see me, if they're sexually active, I say, well, come back and see me in 3 months. Come back. I want to see you on a consistent basis, especially if they feel like they've had some kind of behaviors or potential exposures or things like that. So when I'm thinking about the HIV care continuum, first they need to have their diagnosis. If your diagnosis comes back preliminary positive with me, then I refer you to doctors so you can get conventional blood draw and things like that. After that, I need to link you to care. I need to be able to figure out my specific clinic handles everything HIV related, as far as housing and job and, all the gamut, because like somebody mentioned earlier, this is holistic, right? We're not just looking at one piece of life. Your whole life is affected, and we have to consider the barriers, especially when you're talking about Black folks and then Black women specifically. There are lots of barriers that come into place where people first to even get tested, and then you're talking about care. Then after that, of course, you need to get on your medicine regimen, and sometimes that takes time to figure out what will work best for you, right? Like, there's no like magic thing. It is a process. And
Right.
so being able to do that, then keeping you retained in care.
Yes.
Right? Because
Yes.
it's different. Come on, y'all. It's a difference between starting something and staying retained in care. And so that's really important. And so ultimately, our goal is to get you to suppression. U equals U, which I feel like we will talk about later on. So I won't go into that. But but yeah, so that's kind of the continuum of care, if you will.
Now, do you think that that continuum of care looks different for collegiate Black HBCU attending college women? Because we're talking about housing and all of this stuff, honey. They got that. They don't,
Yeah.
That's what they're in school for. You see what I'm saying? I think a lot of times collegiate women may not see themselves in that continuum of care, and that may also impede their, retention and what have you. What do you think that continuum of care looks like for Black collegiate women?
Absolutely. So I would say it would look the same, except I may not have as many referrals for you because, like you said, you have the housing. Some people still on, the parents' health insurance. I was, until I squeezed that out into the very last drop. So if you were like me in my 20s, I was on that health insurance. Okay. Yes. So for that, we may not have to work with that. But first, I still needed you to get it tested. I still need you to know what's going on. I still need you to be on the medicine. I still need you retained in care. So it can apply. It just will absolutely look different depending on it's case by case, honestly, but your individual barriers. Yeah.
Absolutely. Okay. Now, Dr. Andrea, we talked about the continuum of care, right? And I think that the first thing is getting the testing. Colleges are infamous for doing testing drives and all this. And I see, we have some sorority ladies here,
Yeah.
Y'all have health focuses and thrusts and things and all of that. So y'all have the health component that you're bringing to your campuses, right? But part of the health component that I think may be missing on campuses is what care looks like after you get your results, right? And so when Chanel was talking about that continuum of care, Dr. Andrea, I know I heard you say it, honey, the pharmacy and all of the things. Can you tell us a little bit about what the medical support looks like for people living with HIV, and what it looks like for people that are maybe not living with HIV but love someone that is? Because like I said, when you talk about HIV and AIDS, it's not AIDS anymore, right? First and foremost. And I really want to drive that home because that word has such weight for people.
Yes.
But at stage HIV, it's like I said, it doesn't end your life, it changes your life, and you still have a life, right? And so for people that are living with HIV or people that love people that are living with HIV, what does that medical support look like?
There's a lot of support out there. I will say, right now we have to take into consideration, like you mentioned, it's an advanced, it's a chronic disease. It's not a death sentence anymore. And so as a pharmacist, I get really, really excited about the advances in medicine because it's the treatments that individuals who are living with HIV are able to live longer, healthier, and sustainable lives because of these treatments. And so this is something that I'm very, very passionate about. I get very excited about. And so irregardless, and I like to kind of talk things sometimes status neutral, because even if you're positive or negative, there are tools out there that can help you. So I'll talk on the individuals who are living with HIV. If you're positive, I will say the testing initiatives in colleges are is available. Now, whether or not students will be willing to go, that's the different story, because most times these on the college campuses it's a small infirmary or health clinic, and a lot of students may not necessarily want to go there particularly for this related cause. So they may go to local health departments in their area or local community-based organizations in order to get those testing in a more like secluded or more discrete environment, as opposed to using the college campuses. But when you're looking at the treatments, there's so many treatments now compared to when it first started in the 80s. And just as far as the regimens, individuals should be started at least on a 3-drug regimen combo in order to get their viral levels, hopefully virally suppressed so low to the point to where we can get undetectable levels, right? And so there's a huge push and a huge initiative for you equals you, and that's where undetectable equals untransmittable. But what does all of that really mean? This is a prime example of how treatment in individuals who are living with HIV can be used as prevention. And okay, so like, and everybody, I think in our culture and in the Black community, we think of Magic Johnson.
Mhm.
He's a
Mhm.
heterosexual man who contracted HIV from females and through heterosexual contact, right? So this is something that I think that is very important for people to understand, that it can happen one in any type of relationship. But if you are loving someone who is living with HIV and you're not, there's still treatments out there that can work to help prevent you from contracting HIV.
Mhm.
So long story short, it's a chronic disease, but it is manageable. And there's tools out there for people who are positive and negative in order to reduce transmission of HIV. But the thing is are people in our generations or in our cultures, are they using these tools? And that is a big part of the problem, because they're there, but either they don't know about it, don't trust the system. There's a lot of medical mistrust. There's a lot of just uncertainties of whether or not this is a prevention tool for them,
Mhm.
because there's a false sense of hope, or like a false sense of identifying their perception of risk. And
Yes.
so if they don't perceive it, then they're not necessarily going to try to protect themselves against that, right? So that's one thing that I really want people to understand, is that there's treatments out there. And if you are in a relationship that's with someone, or married to someone, or dating someone who is living with HIV, then you can get on PrEP, which is pre exposure prophylaxis. And that's basically a long word for prevention before exposure, right?
Mhm.
It's very similar. And a lot of women will most likely attribute that analogy to birth control. And then there's post exposure prophylaxis, where you can use treatments in order to help reduce risk after a potential exposure. And that's very similar to what women know as like a plan
Mhm.
B,
Yeah.
right? They want to
Mhm.
prevent pregnancy. So, birth control is to prevent pregnancy before it happens. Plan B is typically like after it could potentially have had an exposure, you have a high chance of getting it. That's how PrEP and PEP actually work, very, very similar to those things. So, knowing what resources and tools and how to get access to those is very,
Mhm.
very important, especially for post exposure prophylaxis, because there's a window, and
Right. It's
everyone,
like the plan B. There's a window.
there's a window of time that is very, very important, that's going to help reduce those risks of transmission. So, with post exposure or PEP, they always say you have to start taking it with the sooner the better, but the window period ends at 72 hours, which is 3 days after. So if you're
Mhm.
thinking about it, you're at a party, it's the weekend, Friday, Saturday night, but a lot of the clinics may not necessarily be open until Monday or Tuesday. There's a 3 day window period, and the sooner that you can get it, the better chances you are at reducing your risk of potentially contracting HIV if you were potentially exposed. And so I think that that's very, very important, that I really want to hone in, because these medicines are powerful. And as the CDC has, their HIV treatment works campaign, these treatments really work. And, individuals can still have babies, still live healthy, normal lives as individuals who don't have HIV. And so that's powerful. And to be honest with you, that's one of the reasons why I became a pharmacist. And just to, piggyback off of Chanel, like I really miss the DMV area, because I'm a graduate from Howard University, College of Pharmacy. And so, just as you're mentioning, um, all the different professions that you see in DC, that HIV does not discriminate, and it can affect anybody. You don't necessarily have to be promiscuous. You don't necessarily, have to be running the streets, or, dibbling dabbling with this one and that one all the time. It's not necessarily like that. And I think that is a myth within the that sometimes I think Black women,
Mhm.
we lose sight of that,
Yeah.
it's like it's not going to affect us because we're in a
We're good
relationship with
girls,
one
right?
person, or we're not out there, we're educated, or yeah. So, the treatments are wonderful, they work. There's several resources out there, whether you have insurance or not insurance, that can help cover the cost of those medications. But
Yeah, yeah.
it's very, very important.
Very true. Very true. And thank you for that. LaDeia,
Goody.
I know you're getting ready to say something, but I'm getting ready to ask you a question. So hold on. Because I'm getting ready to ask you a question.
Okay, because I got to push back because all three of y'all have said it, but as someone who's living with HIV, yeah, I got to push back. But go ahead, ask the question.
That was gonna be my question, right? Because I feel like, we all having sex, so ain't no none of that, right? There's no good girl, there's no none of that. Like, if you're having sex, you need to be mindful, period. But what I was gonna ask you is what do you think, what would you like to see as far as support for Black women living with HIV, support for people living with HIV, support for just, you know what I'm saying? What would you like to see, and what is your pushback? I knew it was coming. I'm excited for you.
HIV is not a death sentence. That is
No.
so cliche and sometimes disrespectful, folks who live with HIV. Because I don't think y'all understand how close to death we may have felt, how in navigating this very nuanced experience. Untreated HIV is yet still a death sentence, right? Mm-hmm. So when you say, oh, it's not, because and not saying that this is your heart, but when we hear it so much, it becomes dismissive. Oh, it's not a death sentence. Baby, do you not know how close to death I have laid sometimes? Like when I can't do nothing but sleep 14, 16 hours straight because this virus is doing what it's doing, I'm in that 8-week continuing waiting for my drugs to come in. And this virus is virusing. Mm-hmm. And I'm still trying to be all things sorority sister, advocate. I'm trying to be, daughter. I'm trying to be auntie, sister, friend, entrepreneur. I'm still trying to show up, and I can't even get up on time to wash my behind and get to work on time. So when I hear that, I always push back, and I said, we have to find another way to say that, because when you deal and talk to someone, maybe my mama thought I died one Christmas morning because I went to bed the day before at 3. I did not wake up until after Thanksgiving dinner at 8 o'clock the next day. I did not get up. So when you see that, and when you're in the hospital and you're fighting infections and you can smell death, and I'm in there, I don't know who's spiritual, but you in there doing like for real, calling on your ancestors, God, yes, angels, you doing for real work because you feel yourself slipping up out of here. Knowing if I was not diagnosed with this virus, I would not be having these type of complications, if that makes sense. Mm-hmm. So that's my pushback. So we have to find another way to say it, because it's no longer a death sentence. Even those of us who are socially, economically up, climbing up the ladder, it's still a mental battle. I may not have died physically, but it's some death that happened mentally. It's some death that happened spiritually once I became diagnosed. Yeah. So we got to find a better way to say that. And that was my, that's my pushback. Now to the question.
And that's a beautiful pushback and much needed, because for those of us that are in community work that are not living with HIV, we still need to be mindful, because that's not our experience, and to be mindful mm-hmm. and to be respectful and reticent of this nuance. Like, that the mental, we are, for my specifically, I think that we want to say, oh, it's not death sentence, blah, 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 because then people lose, they kind of eases that stigma for people. And so they become a little bit more ready and receptive to testing and access to care and all of that. But I do absolutely appreciate and just, I'm excited that you are sharing that with us, because if we don't know, we don't know. And in an effort to try to get people to be receptive to testing and receptive to care, et cetera, this is how that mantra even started, right? But we don't, mm-hmm. in that vein, not mindful of people that have acquired it, that are living with HIV, and how that may be dismissive of their experience. So I absolutely appreciate you, LaDeia, for even sharing that. And just because we all know, but I don't know, I'm not going to be out here like, oh, as a person living with HIV, how do you know what I'm saying? That's why I asked you, mm-hmm. what support do you wish exists for people living with HIV? I'm not going to be out here telling people your stuff. That's your, you know what I'm saying? That's not my thing.
Right.
So that's why I asked you, what support do you want to see that doesn't already exist for Black women living with HIV? And I think even your pushback is a beautiful example of that, of what support could look like for Black women living with HIV, because we don't know what we don't know, and language is alive, mm-hmm. and it lives in and on people, and we don't have time for that, right? And that's what I'm saying with the, HIV is now is advanced stage HIV, et cetera. And what you're saying, we talk about our health matters, our mental health, our physical health, our sexual health, our social health, our financial health. All of those things matter. So I am grateful. Okay, grateful for it. I did want to ask you too, though. When I ask about what support do you want to see for Black women specifically in the realm that we're in, collegiate Black women, degreed Black women, upwardly mobile Black women, because a lot of times when we
get left out the conversation.
You know what I'm saying? You don't see that. Everybody needs assistance in housing and things, and that's true and it's real. But what about the population that's left out that is still, it's like everyone's having sex. Everyone has. So if everyone has sex, then everyone needs to be seen in that hierarchy, marketing practice, and what have you. And as a marketing professional as well,
baby, you all up in my tea, because
you know what I'm saying. I want to know the priority as a member of the priority population, sis.
Come on. No, and I tell people this is a very unique to have like education, expertise, experience, and real life come together. And that's why I love to sit on campaigns and be like, no, y'all got to break this down. You have what I want support to look like for a Black woman is a campaign that is tailor-made to talk to Black women where they are. Because when I walk into rooms, first and foremost, they never think I'm HIV positive. A lot of times when I go to conferences, I wear my letters. So when I come in, they think I am the presenter. The clinic where I used to go to, they always thought I was a vendor and I was there on behalf of a pharmacy company or a doctor. I'm like, no, sis, I'm here because I need help. Why are we still playing this strong Black woman trope? I was diagnosed, and 2 days later, they were just like, well, would you be interested in leading the group? Ma'am, I almost cussed. I'm sorry. Ma'am, I need support. I don't need to, just because I come in here with an emotional IQ and a mental, status that may be a little bit higher than what you stereotypically, let's say that, ascribe. Can you take this strong Black woman off of me? And I wish that the support will allow Black women just to sit and be still. Because I tell people, once I was diagnosed, maybe I was diagnosed at 36 years old. I had saved amount of money. I was buying houses. I was buying cars, cash. I was building an entrepreneur. I was starting to open up my not a nonprofit travel agency. I was about to build out a beauty supply store in Memphis. Like, I'm upward mobile. Like, we at 36, that's what we do. We like, I'm rocking and rolling. And I got hit with a diagnosis. And it was hard to find a safe space. I never was connected to care. I found out, they called me over the phone and told me my diagnosis, and was just like, good luck. And they handed me the paper to the health department. And my best friend at the time was just like, she came in here with private insurance. Why are you not connecting her to care? Is this how you handle the Black women that come in here? Because let's be truthful, we are upwardly mobile. We have better jobs. Our insurance is a lot better. So we going where the white folks go. We can go ahead and just going to be honest and open and transparent. So we going where the good doctors at. We going on the good side of town when it comes to our, our health. Because that's what we do. Like, because when we went to a new city, who was the best OBGYN? Who was the best this? Who y'all go for dermatologists? No, I need the top, honey. Because that's what Black women do.
Yeah.
So I wasn't connected. And I found that to be a thing in my city, that they were not connecting, especially women who come into rooms and look and present like me. It's find it out on your own, because you're strong. You got out the hood. You did what you're supposed to do. You got resources. Ma'am, sir, no. I need the connection to care. So first and foremost is coming from a trauma-informed, trauma-centered, heart-centered approach, but mean it for real when it comes to Black women, because we get knocked out the care continuum. We get knocked out of that conversation. We just be like, figure it out. Also, education, prevention, and awareness catered to the point that you can't miss a Black woman. Because in this chat, we probably got women from ages 18 to probably 55, 60. There are things that are just a nuanced conversation among Black women and girls. We gonna find one common thing. We gonna vibe to the same music. If you start playing City Girls right now, Meg Thee Stallion, everybody on this call gonna pop like, we're gonna bop, right? If you dropped Jill Scott, we gonna all start singing. There are certain shows that we can all relate to. everybody in here probably didn't watch Girlfriends, Living Single, or Insecure. You have to find, it's a nuanced thing, but if you get it and get it right, you will capture and garner the attention of Black women in such a way that HIV does not have to be the epidemic, and we will not have to be the number 2 vulnerable population behind same gender loving man when it comes to HIV.
Mm-hmm.
But I don't think they really want to do that, because if Black women got HIV or contracted HIV the same rate as white women, there would be a 93% decrease in the number of HIV cases among Black women. You got to have folks who live, as in MIPA, meaningful involvement and participation with people who are diagnosed with AIDS and HIV in the room. Mm-hmm. We're out here. We ain't out just with a stereotypical.
Yeah.
Stop making us be invisible.
Yeah.
Like y'all are cloaking us. You heal mother, you heal the nation. Heal Black women when it comes to HIV, you won't have an epidemic ever again.
No. And the thing is too, we think that we have the stereotypical or the socio-demographic, what have you, and that we have the outliers, right? They want to act like women that are high achievers, Black women that are high achievers, are somehow the exception and not the rule. We are very much the rule, specifically in this population. And Black women are getting more degrees and going to more college and doing more business and starting more business and opening more things than any other population in this country. So for us to be the movers and shakers in that, and to also be the movers and shakers in this, we should be included in these conversations. And that's why Our Health Matters is important, in collaboration with the Buckhead Cascade City chapter of the Links Incorporated. Come on, somebody. We are including and talking directly to those of us that that are considered outliers, possibly when the research comes, when the marketing comes, when the companies come, we may be considered outliers, but we are very much a part of this population. And I have a couple of questions from the audience that I want to get to because it's important that we include that. And so one of the questions was, how can we best support our sisters living with HIV? And I think, LaDeia, you answered that question. Include them. Include all of them. Be representational.
Another thing. Mm-hmm. I posted this on Instagram, and I mean this. What would happen if every Black woman who was an HIV positive advocate and activist went and sat down? We're tired, y'all. And I'm saying this, I ain't gonna cry. We're tired because we lobby. Because I lobby. I still work a 9 to 5. I still work a 6 to 10. I have a nonprofit that I'm forming. And when I walk into rooms, there are very rarely women who don't or who are not HIV positive who show up. And I'm going to just be all these social and civic organizations that we have, my sorority included, on down. Y'all got to shake the stigma and the non-association that you want to have with this HIV when it's running rampant. When y'all members are in my inbox, wanted to be walked through discreetly. But I see you on social media talking any kind of way about HIV. And I've walked up on some people from other organizations like, sister, you wouldn't talk like that, because the sister that you sit next to in your grad chapter meeting stay in my inbox. So it's time for Black women to show up for HIV like y'all show up for y'all wear them red dresses during the same time as World AIDS Day. And that irritates the snot out of me. Because it's zero word when it comes to World AIDS Day. But we get all the pink for breast cancer. We get all the red for red dress. And I'm not negating, they're important causes.
Yeah. It's
but
a yes
are they
and.
really as detriment? It's a both and. And so what you can do to support is show up and show out. Get loud. Dressing your sorority colors head to toe, dressing red from head to toe, and show up for these events, because y'all got sisters out here working hard in these trenches. One of my best friends, AK, she said, Dia, this is your Super Bowl. Between November and January 1, we're working because we're fighting during this small time or attention that doesn't come back up again until March for women and girls HIV and AIDS Day to fight. And we get drowned out, not because we're not speaking, because it's not enough of us who present like us, to look like us, to show up and amplify our voices. They not gonna care until we care.
Yeah.
They don't care nothing about how Black women get lost in the care continuum, how we're misrepresented when it comes to laws and and the criminalization of HIV. They're not going to care that Black women are not, women, especially Black women, are not included in U equals U.
Yeah.
They're not going to care.
Mm-hmm.
That's why they care about Black women and breast cancer, because we show up and show out.
Mm-hmm.
That's why they care
Mm-hmm.
about Black women and heart disease, because we show up and show out. Can we get some of the same love?
Yeah. Yeah. And I think
But
if people
because
get, they get in, they get their letters on, they go to your meetings. There are so many women living with HIV that are in powerful spaces, that are making moves, and maybe they're not as vocal about their status, right? So then, what would you say to the women that are not as vocal? How would there be a,
Yeah,
you
it's
know,
stigma. It's too
that
much
stigma
stigma.
is
So
ridiculous.
honestly, and my thing for supporting Black women, whether you're living with HIV or not, I think is we have to build more community. And it's almost like we're still tearing down ourselves within our own community. HIV is running rampant in the Black community because we date each other. Just like Hispanic populations or most cultures, you date your own. So if it's high within the Black population, it's going to be high amongst Black men and women. And then I think another thing, we have to build more community, and we have to communicate and stop hiding so much from one another. We live in this discreet way, and we're not as vulnerable, I think, as other populations when we're sharing our feelings, sharing our emotions, sharing things that we've gone through, because those are the things that nobody's like really posting or sharing on social media. Those
Mm-hmm.
deep, dark, inner secret type things that you're going through and these feelings that we're experiencing. I think also another contributing factor that we kind of have to look into too, is that there is also a scarcity of Black men, and there's more women than it is men, and so we're sharing our men. And so when I talk about community, it's not about being comfortable being that second chick on the side, knowing he has this person and this person and that person, or whatever the case may be. Because as long as you're getting your bills paid, as long as you're getting things that you want, then it doesn't matter, what they're doing. We have to build more of a sense of community, as women, as Black women, to support one another more. And I think a lot of those things will actually help between community and communication, and not living these secret lives will actually help to build the connection that we need in order to see a change that we're hoping and looking for. I think the change is going to have to begin with us first before those changes are actually be implemented out.
I think too, when you're talking about stigma, Dr. Andrea, when we're talking about stigma and having women that are living with HIV, Black women that are living with HIV that are actually affluent, speaking and showing up and being seen, so that other people that are living with HIV that are actually making moves can feel comfortable in speaking up. And you're talking about like deep, dark secrets, etc. That stigma reduction is imperative. That stigma reduction is the cornerstone of of anybody saying anything or doing anything, because a lot of people feel like they can't, right? And you see, even in this panel, there are 3 women on this panel, right, that are not necessarily living with HIV currently, or openly living with HIV currently, right? And then we have LaDeia on this panel that's saying, I'm tired. It's me, and these people are, it's us and it's her. And it shouldn't be. It should be all us, right? And we're advocating, and we're trying to make this shift and move this needle, right? But we have to include and understand that diversity and inclusion is not real. Human variance equity is real. Respecting and making space for humanity in every way that it shows up is real, right? And so when we're talking about stigma reduction as a way to improve communication and community and representation, and what advocacy looks like, what
Yeah.
priority populations look like, right?
Yeah.
We have what I want to just give a quick answer from each of you. What do you think the quickest low hanging fruit to stigma reduction would be in our community?
Take the onus off Black women who are HIV positive.
Mm.
Because doctor said leaving secret lives. Baby, I talk to folks who will never say a thing, and they shouldn't have to. Because it will cost them their life, their job, their security to open up their mouths. So if their advocacy looks like talking to their mother, sharing it with their sister, or disclosing to their family. That should be all they're required to do. But how the low hang with stigma reduction, take it off our plate. Take it solely off of something for us to do. Because that's the quickest way to remove the stigma. Because it's almost, if you show up at an HIV positive event or an HIV event, oh, you must be HIV positive, or you must be living with HIV or AIDS. But if you show up at a cancer event or breast cancer and you're pink, no one makes that assumption.
Right.
Take the onus off of us, y'all. Create brave spaces where y'all take conversations like this and recreate the will and have that conversation be impactful and influential and efficient and effective outside these spaces. Don't let these conversations happen here. That's the quickest way.
Yeah. Yeah.
I would definitely have to agree with that. That shame is something so real, and that you see it everywhere. And I think what will be helpful for that is having inclusive, medically accurate, comprehensive sex education. I'm never going to shut up about having holistic sex education ever, right? Because there's so much that is, and it's layered. There's so much that goes into sex education in general. But I do think having, like everybody else is saying, having conversations within your own circles, you know what I mean? Having real conversations, talking about things openly, and having these real conversations definitely helps to decrease the shame. And I also think that having people who work in healthcare, Black women, like, I can't tell you how many times somebody comes for testing and I walk out and they see it's me and the shoulders go down. You know what I mean? I think that's important. So that way, when I have you in the room and I'm able to have a real conversation with you, it's going to sound different than, if I'm talking to somebody who's older and white or something like that, right? It just hit different, like the youth say. It just hit different, right? And so I do think it's important to have faces in the place and encouraging people to, one, to continue to continue to get tested, continue to take care of their health, but also pass that word along to their communities. Bring some, have these, when we having these events, I used to always drag somebody with me. Let's go. Yeah. But that's because I was empowered to do so. So I tried to do that to other people. So it's definitely, it's so much work. It's so much work. Like LaDeia said, it's so much work. But people living with HIV don't need to, they don't have to be okay, here I am,
The show pony.
Kidding, really, right? Like
representation for our whole everybody.
Right.
Women live with HIV don't have to be.
You know what I'm saying?
Right. It shouldn't have to be like that. Dr. Andrea, give me what you feel like our stigma reduction.
Honestly, the lowest hanging fruit I would say is perception. I think we are missing the fact that we are at risk as a Black woman. And as Chanel mentioned about the lifetime risk factors, we have to be aware of it, not only just aware of it, but understand that that we're at risk, and we have to take precaution and do things that we can, because it's just by our race and our gender alone puts us at risk. It has nothing to do with necessarily your sexual pleasures that you want to engage in, right? Just being a woman, and a Black woman in a certain age bracket, as LaDeia mentioned, between 18 up to 60s, right? Like that's all of us. That's our mamas, our sisters, our cousins. And so we have to me, that is like the biggest thing, is understanding the perception. It doesn't matter what your marital status is, it doesn't matter what your relationship status is. It is your gender and your race right now, from what we see, that is putting us at risk. And so we have to, once you learn and understand that, then you have to put the necessary steps in place in order to protect yourself as you continue to move through our lifetime, right?
Yeah.
Because it's not just a one-time thing. This is an ongoing process of protection and prevention.
Listen, that Chanel can tell you this. As sexologists, we always say the talk is not a thing, right? Being sex positive, being sex neutral, being sex anything is an ongoing, lifelong process. And sexual health is public health. Hate to tell y'all. Sexual health is public health. And so what that looks like on our whole, our health matters on a green table talk with a Black Women's Health Imperative collaboration with the Buckhead Cascade City chapter of the Links Incorporated. What that looks like today is hopefully someone watching got something from this and they're going to take it to their peer groups. I want y'all to take it to your Instagrams. I'm challenging everyone that's watching this. Everyone that's watching this from now to the end of the year, once a week, not asking much, once a week from now to the end of the year, post something about HIV in Black women. Post something to empower and encourage somebody. Post a testing location. Post a testing drive. Post something about PrEP. Post something about PEP. Post something that is going to support somebody that may be living with HIV, may be struggling, maybe thinking they want to go get tested, that is going to nourish and encourage your friend groups and those that you have influence with. Don't talk about it, be about it. I am challenging you. I'm be looking. I'm going to be looking. Hashtag green table talk. I'm going to go look. Okay. What I want to do, y'all, I know we had a Teddy Riley moment and we started a little late. But we are rounding up on time. And so what I want to do is I'm going to go reverse. I'm going to start with Chanel Jaali and I'm going to go to Dr. Andrea, then I'm going to go to LaDeia. I want one or two words. I want you to finish this sentence. HIV is.
HIV is, goodness, I just literally froze. Maybe can you come back to me? Because I had a moment.
Okay. Dr. Andrea?
Yes, HIV is preventable and manageable.
Okay. LaDeia?
HIV is able to be eradicated. I'm trying to make the sentence make sense in our lifetime.
Okay. In our lifetime. I'm here for that. Chanel, your brain working yet? You good?
When I tell you these classes, anyway, HIV is what my dear sisters said it is. Is that an answer? Can I ditto? Okay.
That's a cute ditto.
Yeah, you know what I'm saying? HIV is beatable. Panels like this inspire us to plant seeds for trees we're never going to sit under. But I love what LaDeia said when she said in our lifetime. I'm 41. Look, in my lifetime, I love that. I would love to see HIV not carry the weight and stigma that it does, so that people are getting connected to care and living longer, and it doesn't become this huge or continue to be something that is a deep, dark anything. It doesn't have to be that. It can be a neutral space where it's just it's like blood pressure, diabetes, etc. The mental nuance and mental weight may still be there, but for people to get access and get tested and be on that continuum and stay on that continuum, y'all, we can do this. Black women can do anything. Black women can do anything. And so I just want to thank y'all for joining us for this hour and 3 minutes and hanging with us for our Teddy Riley moment through the beginning, and appreciate, Black women in tech is a thing. We had to get some stuff worked on that wasn't on us, but we worked around and patched it up. Okay. I want to appreciate and just thank the panelists. I want to thank Black Women's Health Imperative. I want to thank the Buckhead Cascade City chapter of the Links Incorporated. And I want to thank y'all for joining us, for asking questions, for being engaged. And remember, I'm challenging y'all. Hashtag Green Table Talk once a week for the rest of the year. Be the light. Be the change you want to see in the world. Make a move. That's what Black women do. Right? All right. And y'all, until next time, thank y'all so much. Be good or be good at it.